Welcome to Tuesday, July 2nd. Wow, we're already halfway through the year. How crazy is that? I was thinking about what to talk about today, and I had a couple ladies in the office that were wanting a lot of information about supplements. And I had two women that were on this particular supplement and asked them why. One, they didn't know, and two, they were told something about this supplement that simply wasn't true. And what I found is that there's a lot of people out there that push supplements that really have no idea how they work, and they just prescribe stuff because they want to sell something, especially in the area of the doctors that put in pellets, because the pellet companies got smart and decided to manufacture or white label their own supplements, which are basically just knockoffs of other companies that basically sell their supplements, and then you just slap a label on it. But anyways, let's start by saying this supplement is probably one of the most overprescribed, overutilized, and the most misunderstood supplement that's out there. Before I tell you what it is, I know it's a teaser, but I would like for everybody that wants to know more information about their hormones, about supplements, about everything you want to know about, lab testing and whatnot, to go to Amazon and get the Hormone Balance Bible. You can go right now or you can go afterwards. It's 500 pages of everything in here that talks about lab testing, each hormone, and then the 12 most common hormone imbalances in women's health, and a 6-step process how you can fundamentally improve your results over time. No, we're talking about not hormones. We're going to talk about the most misunderstood supplement in women's health. This supplement is way overprescribed, it's way overutilized. And I will tell you, 99% of the time, the women that are on it for the wrong reason. And you could probably save yourself $45 or $50 a month if you're already on it. And that supplement is called DIM, diindole methane, or indole 3 carbinol. So if you're on something called DIM or DIM or I3C, or if you're on a women's health supplement that's supposed to help with hormones, look at the ingredients and see if it's DIM. What it is, diindole methane I3C is the chemical compound that is in cruciferous vegetables, i.e. broccoli and cauliflower and Brussels sprouts. And it's a great compound. But why it's prescribed or why it's given to women, first of all, is women that have high levels of estrogen, or what is being called estrogen dominance. That is being touted as something that lowers estrogen. And I'm going to let you in on a little secret. DIM does not lower estrogen one bit, zero. So if you are on diindole methane, DIM, or I3C, and they're telling you that they put you on it because they want to lower your estrogen levels, they're completely lying, or they have no idea what it does and they're just repeating some party line. The second group of providers that puts women on DIM are BioT pellet providers, and it's because they think, because they're overdosing you on testosterone, which I think is hilarious, that they're afraid that the testosterone is going to convert into estrogen, because that's what testosterone does, and they think they're going to mitigate the effects of the estrogen by putting you on DIM. No, it's not going to happen. So DIM, the reason that it doesn't work, what DIM does, and this is just for anybody that wants to know how your body gets rid of extra estrogen. When you have estradiol, it's going to break down into another estrogen called estrone. Estrone is what your body utilizes to get rid of the estrogen in your body, and it breaks it down into 3 types of estrone: 16, 4, and 2-methoxyestrone. 16-methoxyestrone is going to recirculate back into the system as estriol. 4-methoxyestrone is actually considered a carcinogen, and so women that make a lot of 4-methoxyestrone may have an increased risk of cancer. 2-methoxyestrone is the third, and that's actually cancer protective. So wouldn't it be nice if we could move women from the 4-methoxy cancer form over to the 2-methoxyestrone and help protect against cancer? That's what DIM does. DIM pushes you from the 4-methoxyestrone over to the 2, or it decreases the amount of 4-methoxyestrone your body makes. It does not decrease the total testosterone or estrogen in your body. It just helps you try and move it to a metabolite that is actually cancer protective instead of cancer provoking. Now, if you had high estrogen and these physicians or nurses or whoever's prescribing this stuff for you actually knew what they were doing, they would put you on a supplement called calcium D glucarate, because calcium D glucarate, what it does is, as you're trying to get rid of this excess estrogen, one thing you should do is increase your fiber intake, because what happens is that estrogen is going to grab onto the fiber in your stool and you're going to poop it out. Your body's pretty smart, though. What it does is there's an enzyme in your intestinal tract called glucuronidase. Glucuronidase is going to cleave that estrogen off the stool and let it go back into your bloodstream where you probably don't want it. So what happens is calcium D glucarate inhibits the enzyme in your colon that's going to cleave that estrogen off. So it makes your estrogen stay in your poop and you poop out excess estrogen. So if you have a high level of estrogen or your doctor's worried about that, they should be putting you on calcium D glucarate or CDG and not diindolylmethane or DIM. That's just for you geeks out there that want to learn different things and you want to know more about how your body works. And I will tell you, because I see women that are on diindolylmethane or DIM all the time, and they're always told it's because their estrogen was super high. That just tells you right there that your provider has absolutely no idea what they're doing. So, and that they're very influenced by some sort of marketing person who told them that they could sell a lot of DIM, especially if they're putting in pellets. Now, as I've always said, if you have a question, go ahead and drop it below. We've got about 3.5 minutes or 4 minutes to answer any type of questions. I can't answer personal medical questions, but I just wanted to come in and talk about DIM and how it's probably one of the most overprescribed, misunderstood supplements. I talk about it a lot in my chapter in my book, The Hormone Balance Bible, on the queen, because the queen is the archetype in my book that is high estrogen. And so one of the supplements that we talk about is DIM, and I also talk about calcium D glucarate. So if you want to learn more about estrogen and about supplements, high estrogen, low estrogen, supplementation, the way to administer estrogen, please get a copy of the Hormone Balance Bible. Obviously, I will love you even more than I already do, just like I tell my children. No, I'm kidding. But no, it's a great book to have, and I think that it's a good reference book. Is estradiol at 84 considered high? I can't really answer that. I mean, it's in the normal range. We know that you need to have an estradiol level of 60 to protect bone. So you want it at least above 60. I mean, 84 is pretty close, and it's not like it's 600. But what's important is there is no optimal number per se. You want it above 60, and you want it so that you are comfortable, that you're not having hot flashes, that you don't have vaginal dryness, and that it's protecting your bones. Hello from Australia. Appreciate the coming at you from Austin, Texas. Appreciate you coming on. I know the time there is probably early in the morning, if I'm not mistaken. So any other quick questions? Bought your book on Amazon. My doctor prescribed testosterone and DHEA troche, 5 milligrams each. So 5 milligrams of testosterone can be a lot, and 5 milligrams of DHEA is like peeing into the ocean. I mean, well, not that dramatic, but I usually, when I prescribe DHEA for women that are low, I usually start with 12 and a half. 10 would probably be a good number. I don't know why they're replacing your DHEA or even if you need it. But a 5 milligram dose of testosterone can be kind of high. The other thing you need to know about taking medication as a troche, which is a sublingual tablet, is you're going to get a release all at once, right? It's because it's dissolving. So it all goes into your system at one time. So you might feel okay in the morning, but you then might peter out in the afternoon. And that's because you're completely out of hormones. In those cases, what I tell my patients to do is cut the troche in half and do half in the morning and half in the afternoon. And somebody just asked that. So I can't tell you to do that because you're not my patient. But in my patients, that's what I do. And I do talk about that in my book, The Hormone Balance Bible, that you can get on Amazon. Yeah, I said it again. Any other questions? We got another minute or so. I'll be more than happy to entertain a hormone related question or something along those lines. Otherwise, if you didn't catch this at the beginning, I'm talking about how to lower estrogen levels and how DIM is probably one of the most misunderstood supplements on the market, and how most people that are on it probably don't need to be on it because it doesn't lower estrogen at all. If you want to lower your estrogen, you have to use a supplement called calcium D-glucarate. That's how you lower your estrogen, but not with DIM. DIM does something completely different, and most providers out there, unfortunately, are using it for the wrong reasons. How long from peri until postmenopause do symptoms disappear? I have absolutely no idea. You're totally different than the person next to you. Perimenopause can last for a decade, and menopause, again, same thing. Some women have menopausal symptoms. I just saw a lady today that's 70 and she still has hot flashes. I've seen women in their mid 50s that don't have any symptoms. So it's one of those things. Fibroids after menopause. I have a podcast called podcast called Confessions of a Male Gynecologist. It's on Apple, Spotify. There's a total and a complete episode on fibroids if you're interested in listening to that. Sorry, I got to close one of my eyes. Seeing a new GP tomorrow, hoping she does more than shrug her shoulders at me. GPs unfortunately tend to not have a whole lot of depth when it comes to hormones. I mean, heck, most GYNs don't. You really might need to go outside of your area, but hopefully the first step in finding a new doctor is one, that they'll listen, two, that they'll actually order the labs to help, and then three is that they know what they're doing when they're prescribing hormones or supplements, and they don't just say stupid things like, well, what's the point in ordering labs? Your levels fluctuate, or I don't do labs, or whatever it is. That whole narrative is complete trash. And if you get that, then please, keep looking around until you find somebody that you enjoy. You can go to my Instagram page at Sean Tassone, MD. My second pinned post, I have all the states where I'm licensed. I'm currently licensed in about 34 states, so I can see almost everybody in the country. And if you call my office, you can make an appointment. I do telemedicine visits. I don't take insurance, but I'm not here to gouge you. What would you consider the best form of hormones? Bioidentical. I mean, the kind of that looks very similar or almost identical to your body's natural hormones. As far as the delivery method, sublingual creams, whatever. I mean, I don't know if there's a best, because again, everybody's different. Some women don't absorb very well. Some women don't do well with the sublinguals. I mean, you have to kind of keep trying until you find the one that's good for each individual person. And that's why you need somebody that actually cares, so that they can take the time, they can follow up with you, and they can give you the things that you need when you need them. So it's not, nothing in the world of hormones is ever really cut and dry. There's little nuances here and there. And so Combi Patch is a replacement form of estrogen and progesterone. Both hormones are in the patch. The problem that I have with Combi Patch, and the reason that I don't use it, is because the form of estrogen in Combi Patch is estradiol. The form of progesterone in the Combi Patch is a progestin. I personally find them to be somewhat horrendous. I don't like progestins. They don't help you the same way progesterone does. And it's the same form of progesterone that's basically in a birth control pill, so I don't use it. But some people do. The veterans, the veterans, is that what it said? Yeah. Veterans can go outside of the veteran system and pay for their hormones. Usually it's $45 for hormone replacement therapy if you go to a compounding pharmacy. So you're not stuck with Combi Patch. And technically, you could still ask for estradiol and progesterone, bioidentical forms of those hormones. That Dottie is a patch, Climera is a patch. That's just the estradiol, and you can ask for bioidentical hormone, progesterone. So yeah, there's other options. You're not stuck with one thing. And if you can swing $45 to $50 a month, you can definitely go off post and use a bioidentical compounded medication that's available to everybody. And even if you're not in a big town, there are pharmacies around the country that will ship anywhere. Thank you for doing this video. I wish you were licensed in South Carolina. So here's the problem with the Carolinas. There is an interstate consortium called the MILCC. It's about 35 states, 36, give or take. And they've all agreed that if you're licensed in one state and you click a button, you can get licensed in the other state if you just pay the fees. The Carolinas didn't want to be a part of that for some reason. And so it's not that easy. And so when you apply to one of those states like New York, California, Florida, Pennsylvania, you have to go through this huge vetting process. You got to fill out the application, blah, blah, blah. They ask for all these little nitpicky things. It's really fascinating and perfectly stupid, actually, if you ask me, that they do this kind of stuff. But it makes it harder to get licensed in that state, and it takes a lot longer. So I won't be doing that probably this year. Right now I'm working on Pennsylvania, and then I'll be moving on probably to Mississippi or something after that. But South Carolina will happen eventually, I promise. So I'm going to leave it here since the questions have died down. Remember to share if you can. I really appreciate it. Subscribe if you haven't. And head on over to Amazon and get a copy of the Hormone Balance Bible, because that's where I pull all this from. So if you like my content, my book is even better, and you'll have it all in your hands. Have a good one. I'll see you tomorrow.